think I've had enough. I might get a...
Okay, hello. I am making a video about my hysterectomy at 30. A lot of people have been asking me what type of surgery did I have and what happened, why did I have to get a hysterectomy at 30. So, and of course not from YouTube, as you can see, but just family, friends, and just, you know, random people that know, associates that know me and knew that I had surgery and wanted to know why did I have a hysterectomy. Okay, so well, this happened like 6 years ago after I had my daughter. I was having real bad severe cramping, just pain, overall body pain, and at that point in time I had a lot of bleeding going on. Bleeding so bad that I would have accidents. I remember a time when I had an accident at work, which was embarrassing. I would have accidents at home. It was to the point where I really didn't want to get out. I really didn't want to go anywhere. So, yeah. So at first I thought it was just normal. That was just something, my body had changed. I had 3 kids. So my body was just going through a different cycle until repeatedly I would just be in pain. And I'm just like, this can't be cramping. Like, this type of pain can't be your normal cramping. And it was to the point where, you know, you have your cycles every 28 days. I would be normal. It would come every 28 days. But like a week before, mentally, I would just be drained and tired and experiencing different types of body pain. It wouldn't be necessarily cramping, with just body pain. And then the week that I was about to start my cycle, I would be in so much pain to where I would just be popping ibuprofen, popping ibuprofen, popping ibuprofen. And that wouldn't even help. And then after my cycle, I would still be in pain. And I'm just like, this cannot be your normal cycle. Like, this just can't be your normal pain that you would have after you have a cycle. So eventually I decided to go to my OB-GYN. I informed, at that time it was a male. He didn't really do anything about it. He put me on birth control. I had the Depo shot. The Depo shot was mentally making me crazy. I would have heart palpitations. My hair was falling out. And I would just, my anxiety level was just at an all-time high. So then I got off of that. He put me on, well, not put me on, he inserted the IUD. Now, I'm not sure if anybody's familiar with the IUD, but once you get it placed, you have to come back a month later to make sure that it's still in place. Well, when I came back from a month later, it was not in place. It had moved up some. Thank God it didn't attach itself to anything on the inside. So he ended up taking it out, and he said, well, no worries, we can put another one in. I was like, hell no, I'm about to put another one in. So I didn't do that. So I was about to get the E-Shore, which would, if you're not familiar with that, it is where they plug your tubes to where you can't have any more kids. Almost like getting your tubes tied, but this is where they insert tubes inside. I'm not really sure what happened with that. I know it was some type of issue and complication, so I just didn't worry about it. So years and years has passed. Wasn't taking any form of birth control. When I would have intercourse with my husband, just be, it is what it is. But we knew that we both didn't want any children. As time went on, still having this pain, I was just like, maybe this is something that I would have to deal with. And of course, I am a Christian, so I pray over myself constantly. Eventually, I switched doctors. I went to a female doctor, and she wanted to do a procedure in the office where they would stop the bleeding. She wasn't too much concerned with the pain, I guess. Just some type of procedure where they would stop the bleeding, and I would insert that name or put the name up of what procedure that would be, and that was going to be an in-office procedure. going to her constantly, she would tell me that we cannot, she did not want to do any invasive operation on me or procedure on me because I was young, and she would always say, well, we need to do stuff, like over the counter stuff. Like, let's just kind of continue to see what we can do to help you without having any type of invasive surgery. Now, at that time, I believe I was like, I want to say 28 when they were telling me, no, we don't want to give you surgery, blah, blah, blah. And I constantly kept telling the doctors, I don't want to have any more kids. I don't want kids. Please give me surgery. I don't want kids. Because that would be the only thing that they would talk about is kids, if you want any more kids. Then eventually time went on, still dealing with this pain, still dealing with all these issues, and no one still never diagnosed me with anything. I eventually switched doctors, went to a male doctor, but I would have to see the physician's assistants. So I remember going in, again, complaining about pain. Like, what can I do for this pain? Because the pain is driving me crazy. Like, forget the bleeding. Pain was just unbearable. I remember nights where I would be laid up in bed and literally could not sleep. I would be curled up in a fetal position, rocking back and forth. I would get in the lay on the floor. I remember even taking showers. Like, I would constantly just keep getting in the shower, letting that warm water run on me, just hit me, because it would help me deal with the pain. Well, I would say kind of soothe it, but it didn't really mask just the intense pain that I would feel, but it would help me feel better. Just the warmth of that water running on my stomach, running on my back, just running on me. It would just help me feel better. And so it was real bad. Like, my husband was like, no, you need to go to the doctor and let them know what's going on. And I'm like, now listen, it's been 4 years, 5 years. I have done that. I'm not understanding why they don't understand me. And it's funny. I hate to say, but all the doctors would think that I would have like anxiety issues, and they would try to prescribe me medicine for anxiety. And I'm like, are these people crazy? Like, I am experiencing pain at an all-time high. I don't know what's going on. Somebody needs to fix this. So that went on. Ended up seeing a physician assistant at the facility that I'm currently at. And she did an ultrasound, and she seen that I had 2 small fibroids. And I remember her mentioning something that there was fluid leaking on the inside, but I mean, again, she didn't think that it was the 2 small fibroids and that fluid leaking. It wasn't anything serious. They couldn't do anything. And she would tell me, well, I don't see why you would be having issues with these 2 small fibroids, but keep coming back during your annual, and we'll do you an ultrasound. So I mean, I can't really do anything. I can't force them to do anything for me. So I would just be like, okay, but still not happy, still not feeling good, and mentally I was drained. Like, mentally I just couldn't. The thought of having another cycle just drove me crazy. So fast forward to this year, I ended up having a cycle, of course, and the pain was so severe. Like, I ended up taking ibuprofen. Oh, and another thing on that ibuprofen, one of the doctors years ago told me I am overdoing it on the ibuprofen, meaning I'm what do you call it? I'm taking more than what I should be. Well, I guess technically you'll be overdosing yourself on pain medicine. That is exactly what I was doing, but it wasn't doing anything for me. It wasn't doing anything. So, okay, so fast forward. This year, I ended up having my cycle. I took ibuprofen. Didn't help. I took Midol. It didn't help. And I don't know if I mentioned, they prescribed me some naproxen. I was taking the naproxen. Didn't help. that's when I drew the line. The next day, I got up. I went to the, I got up, I called my doctor's office, my OB-GYN, and I said, I can't do it anymore. Enough is enough. I need to be seen. And I need to be seen where you guys do the max on me to find out why am I having this pain and why won't this pain go away. So they got me in the next week. I ended up talking to the doctor, like actually going into his office, having a conversation with him, letting him know what was going on. And again, you know, they always ask you, well, do you want any more kids? You're young, you're only 30. No, I have 3 kids. Hell no. So, and me and my husband had already said, no, we don't want any more kids. We're done. So ended up talking to him, ended up going back into the exam room. He did a biopsy of my cervix. Then he scheduled me for a histosonogram, and I'll put the name up here. What that is where they insert a catheter inside your vagina, your vagina, inside your uterus to see exactly what's going on. They do a lot of measurements. They also look to see like if there's any fibroids, if you have any polyps, if you have endometriosis, and all of that stuff. So scheduled me for that. It's an in-office procedure. I went in for that. I did fine, didn't have any issues, took pain medicine before they did the procedure, and that was it. Afterwards, you do experience a little bleeding, but again, you can look that up if you want more information on that. After that, they called me with the results, and I found out that I had a polyp, and then I had endometriitis. They didn't say endometriosis, they said endometriitis, where the lining of your uterus is inflamed. So they gave me antibiotics to take. They also, after that, scheduled me to come back in. So when I came in, I spoke to the doctor, and he wanted to do another procedure. And this procedure was an in-office procedure, but you have the option of doing it in a hospital or an outpatient center. I was like, heck no, you know, I'm not paying any extra money to do this procedure. So came in, they actually put me into the exam room in the doctor's office. So went in there, they strapped me down. It was almost like if you was getting a procedure. They tilted me with my head down, sort of, and inserted some type of tools in, and pretty much it was just trying to get a measurement of my uterus and exactly what was going on, if there was anything else in there. So I ended up meeting back with the doctor after that visit, and again, he told me, hey, I'm going to give you some options of what you can do to help with your pain and your bleeding. But throughout all those options, they still would lead me to end up having to have what this whole story is about, a hysterectomy. So, and when hysterectomy was one of the options. So of course I was like, no, I can't do this anymore. I need a hysterectomy. So after that, again, there was really no exact pinpoint diagnosis for me. It was just endometriitis, adenomyosin or something like that. And again, I'll put the name up for you. And 2 small fibroids, which again, they said the fibroids couldn't cause any, pain or anything like that for me. So we scheduled a hysterectomy. I ended up getting the robot, so the laparoscopic one, where you have incisions. You have 3 to 4 incisions, and I actually have 4 incisions. So fast forward, ended up having the hysterectomy, did all the necessary procedures to have that. Now, the things that you have to do to have a laparoscopic hysterectomy is horrible. I had to take, oh my God, I don't know how many amounts of mineral oil. Then I had to do an enema, and this is stuff the night before. Then I had to take a shower with the hospital's body wash. And again, you'll get all this stuff when you do like your pre-op stuff, which would be your lab work, chest x-ray, an EKG. They'll let you, you'll get all that information when you get that done. So I ended up having a laparoscopic hysterectomy. Surgery went well, according to what I know, until I met back up with the doctor. The doctor did inform my husband that once he opened me up, it was crazy. He honestly said, and he even told me he had to do a lot of praying when he seen what was going on. So my uterus and my bladder had a lot of scar tissue, and it was actually it was kind of adhesed together. It had a lot of adhesion on it. If I'm saying that correctly, it was bind together. So he had to try to cut that apart. I had tons of scar tissue, and he didn't quite understand why I had so much scar tissue when I never had surgery before. It was pretty bad, he said, on the inside. And so, and thank God I've been doing well. I had my surgery May 15th, and I want to say it's 5 weeks. I'm 5 weeks out, almost 6, and I've been doing extremely well considering all the stuff that I've been doing when I should have been laid up. I've moved. I had to pack, of course, and it's just crazy. And then the house that we have here, stairs, I'm walking up and down the stairs, so it's crazy. So I mean, I thank God that I'm doing exceptionally well. After my surgery, I had my follow-up appointment with the doctor, and he actually showed me pictures of my insides. And my insides, when I tell you, my insides were horrible, like horrible. Everything was, and I want to tell you, I'm with the surgery, I don't have my uterus, my cervix, or my fallopian tubes. So I only have my eggs. And, ovaries, sorry, not eggs, my ovaries. So that kind of freaked me out when I had my follow-up appointment with him, and he was telling me that I only have my ovaries. So, yeah, and that's because they don't want me to go into early menopause, which I'm fine with that. I don't want to go into early menopause. And he also told me that I had a severe case of endometriosis. And I'm making this video because I don't know if anybody else has experienced going to tons of doctors. When I tell you I went to tons of doctors, nobody could help me. Nobody could tell me what was going on. Nobody could tell me why was I feeling like this. And it almost made me think that I was crazy. Constant prayers, constant just laying hands on myself. It was just crazy because nobody could find out what was going on, and everybody wanted to mask the initial pain that I was having. Everybody wanted to put me on birth control, or let's do this in-office procedure to kind of deal with the bleeding, but you're still not dealing with the pain. And I remember telling my husband, I refuse to be on pain medication for the rest of my life. No. And the fact that I was in my late 20s, and I'm 30 now, and I'm just like, this can't be my life. Like every month I'm in pain, every month just bleeding, miserable, didn't want to go anywhere, would lay in the bed. And I have a family, and you know, and I can't even really deal with my kids or my husband because I'm just like, mentally, I'm drained. And even after my cycles, I would still be mentally drained. So, I mean, it was a lot. And to find out that having to have surgery to find out what exactly is going on with me was really just baffling. Just telling my husband that's crazy that all these years I've had endometriosis and nobody could tell me. I know my doctor, he did an exceptional job on my surgery. I'm very, very thankful. Also, he's still concerned about me as well because the surgery was just, I guess, that serious. He's always concerned. He's like, if you have any issues, please call me so we can get you back in. Because, you know, just knowing that your insides were as bad as they were when we opened it up, it was just, you know, so. But yeah, I wanted to make this video because so many people ask me, why did you have to have a hysterectomy? And do you want more kids? And the answer is no to that, more kids. I'm just ready to enjoy my life. I do feel a lot better. I see a change within my skin too, because I also dealt with a lot of skin issues with having, I guess, you know, just your hormones and stuff like that. Mentally, I feel better. Now, I have lost some weight from the surgery. I know before surgery I was 137, 38, and it looks like I'm back down from the last time I got weighed to 135, 132. You know, it fluctuates. I guess it depends on what type of shoes you have on today. Okay. But, yeah. I just wanted to make this video. If you have any questions, please leave it in the comments box. I'll try to answer those questions for you. I hope this video made sense. I hope this video helps somebody. Like, don't stop going to the doctor when you know something's not right. Like, you know your body. And I'm not saying that the doctors don't care or they see so many patients. It's just like, well, you know, whatever. You're dealing with the same thing that the other person's dealing with. And it's not true. You need to make sure that you find out what's going on with your body. And the sad part is I had to have surgery to actually find out what was going on with my body. So, yeah. And that's all I can say. I'm very thankful, very grateful that I've had it. I know I have a lot more recovery to go, but I'm grateful and I'm glad that I was able to have that surgery. So
I think of